Good evening and welcome everyone to today's session. As usual, we'll start our meeting with a silent prayer. Good evening once again and welcome all the participants for today's session. Today is our 891st day. We are approaching 1000 days. We are actually completing 3 years. And I'm really appreciating all the participants for your enthusiasm and dedication for attending our session. It's really a great achievement for them also, because for normally we are studying for 3 years. We are studying for 5 years. Likewise, you people are studying for 3 years. Now you got degree. So really that will influence their practice, their life. So everyone will benefit from this, and we both we also benefit from you. That's a real growing. Actually, our IFPH is growing day by day. Really happy to see that. And today's our guest is Dr. Beatrix. She is our Germany representative, and all of you can hear me, right?
Yes, okay. No problem.
Okay. And she's so dedicated. She's so dedicated to attend. Even on time, she will be here. I'm really appreciating her dedication and enthusiasm. Thank you so much, Dr. Beatrix, for coming to take class today. And all of you know about her, but even though I'm saying few words about her. And she's a medical doctor since 35 years, and her specialization is in dermatology, pediatrics, and general medicine. And she was practicing homeopathy for 30 years. And she worked in a hospital. That is the only one hospital practicing specialized in homeopathy. So not practicing, specialized in homeopathy for severe conditions like allergy, asthma, and neuro and dermatitis. And for 27 years, she is working in her own clinic, and she is regularly teaching Central Homeopathic Organization in Germany and giving seminars to Portugal for 8 years. And today's topic is long-term cases in homeopathic practice. Dr. Beatrix, please welcome. Unmute and talk, doctor.
Okay. No, it's better. Yes.
Yes.
So thank you. Thank you very much for your kind words. And it's always a pleasure to be with you. And I felt a bit sorry to hear that you are meeting as an IFPH family now in February, and I will not be with you. That's I feel sorry, but
really we also feeling very sad, but after many years we will conduct the same meeting in Germany also. Because we have international we are the IFPH is international group, no? So this is the first meeting, that's why it's here. Then yes. Further meetings will be in many parts of the world.
That's very nice. Or in case it's a very nice meeting and you want to repeat it next year in February, I will come. I wanted to come this February, it was not possible, but next year I'm sure I could come. So we have to talk before, yes? We
make contact. Of course.
Yes.
We will plan it. We will
plan it. Would be so glad to see all the group together and see everybody personally. Would be a great pleasure also, yes.
Really.
So why did I choose that topic for today? I've working in my own practice now since 29 years. And I have some patients I could accompany through long intervals, like 25 years, 28 years. I still have patients, they come, they're still part of my patient family. I have a big patient family, and if they need something, they come. And as we are growing with our experience, it's very interesting, or let's say it's also demanding to be the companion of a patient for so many years. If he comes with an acute condition, okay, then a chronic condition, okay. But 10 years, 15 years, 20 years, 25 years, 30 years now. And it's interesting to talk about that dimension in homeopathy, how we can have our homeopathic treatment with our patients long term. And now already the grandchildren are coming. So that's something also very nice and interesting. Perhaps I should open the screen. So can you see the slides?
Yes.
Yes. Okay. So I will start with a very special person. This is, just a second, this lady. I know her since more than 25 years. And the case history, in that time she was 53 years old. I know her since 1997. Her children were little, now the children are grown up and working, so it's a long period. And she's coming in certain intervals. So and she's always coming to ask for homeopathy because she sees the effects, she likes that form of therapy, and also because she has a kind of special complaints. These people who have special complaints, which does not measure very well with our, let's say, normal medicine, these people like to come to our homeopathic practice. And perhaps it's a bit different than in India, I don't know, but here in Germany, if we have a private practice, we have time. We have time to talk, we have time to have our notes, we have time to follow the cases. So she had a special form of epileptic attacks. And it happened like this. If she was working a lot, concentrating a lot, and also starting to work with a computer in these times, 20 years ago, if it was too much for her, she got kind of epileptic attack. She was feeling very weak, had to lie down. She had tears coming down from her eyes. And she could understand every word, but she could not talk. Once it happens that she had such an attack in my office, and she was lying down, I was sitting at her side. It takes much more or less, it takes 15 minutes, 20 minutes, and afterwards she can move again. But normally for one day, she's very tired. And she feels weak in her muscles. So she was diagnosed in an epileptic center, and they said it's not a typical epilepsy. It's a kind of overexertion of the brain. And why? This lady, since birth, perhaps we can see that in her face. Since birth, she has a congenital difficulty with her eyes. The eyes are not going in the same direction at the same time. So she's seeing two pictures at the same time. And this is disturbing the mind, the brain. So for this lady, it's much more difficult to concentrate because she always sees these two pictures at the same time. And now with the computer and the screens, it got even worse. But she was managing well. She had a very good job. You know what she did? She was, how shall I explain? We have here in Germany, we have a town, and somebody is responsible for all the management of the town. It's a council, it's like a council, yes? And she was working in the financial sector, and she had to control the finance of that town. She had to control the people, the majors of the town who were having costs, spending money, income, outcome, and she was expert on that. So that was a very highly qualified profession, and she did like it. So normally, okay, a few words to her personality. She's really very friendly and also very sensitive. If she is stressed during work or emotionally, could be also stress in the family. She can have epileptic attacks followed by a strong weakness and difficulty in concentration. And we found a very good remedy for her. Causticum C30 normally is improving the muscular weakness quickly. She says it's working like a miracle. So imagine, let's say 5, 8, or 10 years, it was working like this. Every few months, she was phoning me and she said, Dr. Beatrix, I need your help. I said, she always was embarrassed that she had an attack. So she said, Dr. Beatrix, I need your help. So I said, did you have another attack? Yes. I said, okay, how do you feel? A bit better, but you know, my brain, I still feel so weak, my muscles, what shall I do? So I said, take Causticum C30 and tell me tomorrow how it is working. So next morning, Dr. Beatrix, much better. I cannot believe it, always like this. It's like a miracle. She's a person who is very a bit expressive. It's like a miracle, very great. Okay, so this was going for many years. And I could help her to have less attacks, but from time to time it was, and the family knew the situation, the husband, the children, that was no problem. So, and this is happening sometimes. I don't know, also Dr. Manoj, you perhaps also will have that, and you in your practice. Something is working long time very well. And from one day to another, the homeopathic remedy is not working anymore. That is a surprise, which is not so nice. And it's happening sometimes. So I'm presenting that case to also explain how we can proceed in such a situation. So I told this. So we have the situation 5 days ago, she had an attack and she took Causticum C30 like always. The concentration is better, the head is better, but she said, oh, I'm so weak in my muscles. So I told her to take it again, but was not helping. And she really was suffering. Normally, the next day it was better. Now it's the 5th day and Causticum is not helping. I don't understand why. But sometimes we don't understand. So I said to myself, something is strange, but what can I do now? If we are thinking about remedies for muscular weakness, we could think about galsemium, plumbum, different remedies, and also Kalium phosphoricum. So I was thinking about Kalium phosphoricum. But what is the connection between Kalium phosphoricum and Causticum? I'm not looking for a very, very different remedy. The remedy must be close to Causticum because Causticum was always helping. So I said to myself, okay, And I know the patient since many, many years. So years ago, or 1 year ago, she had back pains. And because of the back pains, I gave Kalium carbonicum, which was helping. I remembered that. Okay. Kalium carbonicum was helping. Another winter time, she had a strong sinusitis, also helped by Kalium carbonicum. And she's a professional controller of finance of the local community, which is part of Kalium personality. They have the rules, they have their, for me, Kalium patients can be very sensitive, very soft inside, but they always have an element of rigidity or controlling rules, and that everything is going in a correct way. So I said to myself, I was thinking, what's happening after 10 years, causticum not working? Perhaps Kalium phosphoricum. And I thought, okay, causticum was only remedy Dr. Hahnemann was preparing himself. It's original, created by Dr. Hahnemann, causticum. It's a very nice remedy, as we all know. And it contains calcaria, sulfur, and also kalium. So that was another point for me, thinking in a kalium salt. So I gave Kalium phosphoricum C30 for 3 days, and she recovered very quickly from her muscular weakness. Okay, but we don't stop here. Time goes by, the patients are coming again. We never know when it's having the end. A year later, she developed strong symptoms of menopause. Very high flushes of heat, strong hypertension. She had to go to the hospital. She phoned me. I was at the hospital 2 days ago. It was so terrible. And very strong lack of concentration. And now, because she is in menopause, she is more warm-blooded. She's not cold-blooded anymore. And Kalium carbonicum is cold-blooded. So I said to myself, okay, now she's in menopause. Kalium carbonicum was helping a lot, also Kalium phosphoricum. What shall we do now? A warm Kalium carbonicum. So I decided to switch to Kalium sulfuricum, which was of really great help. And sometimes she had to take 200 because she could not sleep, a lot of perspiration, very weak at night. She had to change her robe at night, her clothes at night. And there was a time she was taking Kalium sulfuricum diluted every night before going to sleep, which was helping a lot. Just a comment on menopause. I like to treat women in menopause because homeopathy is helping a lot. And we have to understand the change of hormones. They are also like waves. There can be some weeks, 3, 4, 5 weeks, which are very strong, and afterwards it's less. So as I understood this, if the wave is very high, sometimes as a potency, they need 200 every day. If the wave is on the low point, they have better, but not 100%. They don't want to take hormones. No hormones, no. And it could be possible to give a lower potency, or I prefer LM potency every day. Or it could be also some days she does not need anything. So with menopause, it's not possible to give the remedy once, wait, after 6 weeks, give it once, again, wait. No, we have to adapt with our potencies. Yes, you understood what I wanted to explain? Okay. And also, years before, she had joint pains of the knees and problems of the stomach. And she had, menopause. And now, years later, because I'm talking about 25 years at the moment of the patient coming, 25 years. So menopause was okay. And now, years later, she is a bit older. She started to get joint pains in the knees and also problems in the stomach. And because menopause is over, she's not so warm-blooded anymore. She's cold again. I will not explain the remedy. You have to ask at the end of the presentation. No. So I was thinking, okay, Kalium sulfuricum was very good. Kalium carbonicum was very good before. Now she's cold again. And I gave Kalium carbonicum again with good result for stomach problems and joint problems of the knees. Okay. At the moment, she's in a special situation. She stopped working because of her age and also because it was too much concentration for her. And she stopped working outside. But now she has 3 elderly people she has to take care of: her mother, her father, and the mother of her husband. So, and these 3 people are very demanding. One is suffering from cancer, the other is very obstinate, the third one has dementia, and she has to visit them every day, mixing everything. She has a great heart, but now she's really under pressure again. And she said to me, "Oh, my head, I cannot stand it anymore. I get depressed. I'm crying. It's too much for me. It was better for me to go out to work with my job." So I said to myself, that is not the situation of Kalium again. No. So I gave her another remedy. You know, everybody knows that remedy. She needs psychological help at that moment. So I gave her Ignatia. And with very good effect. She said it was such a wonderful effect. After some hours, she found herself singing. She was not crying anymore, she was singing. The problems with the mobile nurses, she could handle much better, and she had more self-confidence. So she had a very good effect. And I started 2 years ago, I started to have a diary in my practice. Very special points I write down in a diary, and perhaps later I will write it as a book. And some patients say no, and she knows. So if there's something very special, it can be there. So she said it was such a wonderful effect with Ignatia. I found myself singing. So I said to her, okay, you again will enter in my diary. And next time she's coming, she says, Dr. Beatrix, I have again something for your diary. I have something special for you. So it's very nice to have a documentation of what's happening with our patients. So it's beautiful and also demanding to treat our patients throughout the years. The remedies they need often have a connection. That's my message of that case. It's not a very different remedy. Causticum and Kalium phosphoricum, they have a connection. Kalium sulfuricum, Kalium carbonicum. And if we understand the structure of our remedies and of the family of our remedies, treatment can be much easier. So as I talk about a long-term case, it never ends. So by coincidence, last week, she came again. Last week, very fresh. She came again. And she has a skin eruption here in the chest, very itching, very strong. She has never had that before. And I said to her, but what's happening here with your part here? And she said, Dr. Beatrix, that's where I feel the problem. It's in my heart. I have so much stress again with the youngsters, the father, mother, and the mother-in-law. I think I developed that rush. I want to escape my skin. It's too much. It's so much stress for me. So, okay, I could have given Ignatia again because of emotional stress, but here I was giving again the basic remedy, which was Kalium carbonicum, LM potency, 10 drops twice a day. And she phoned me yesterday and she said, the itching is much better. After 2 days, it was much better. So I said, okay, now we can reduce. It's enough to take it once a day, 10 drops. Okay, so you see, with our patients, it's always a surprise. You think they are well, coming again with something different. They are well, coming again with something different. So I have another case for you. It's a case of psoriasis. And psoriasis as pathophysiology is multifactorial. And it shows epidermal hyperproliferation. It's like this. Normally the skin needs 28 days to be renewed. Our skin outside here, everything will be new after 28 days, like the moon phase. It's a biological measure. So with psoriasis, the proliferation rate will be not 28 days, but 4 days. So it's much quicker. And because of this, we are developing that kind of scabs and typical lesions here. So we have different forms of psoriasis. We have psoriasis vulgaris, a normal psoriasis. Then we have psoriasis guttata. We have little drops, guttata. You can see on the body. Psoriasis inversa means you don't have it outside. You have it at the, you have it inside, under the axilla, in the genitals. That's psoriasis inversa. And we also can have a lot of psoriasis on the head, where we have our hair here. If we have a lot of scabs here, it can be a sign of psoriasis also. So I have the case of a very nice young man. He's a teacher, 34 years old. And he's coming with that kind of skin eruptions. He has these skin eruptions since many months now. He went to the dermatologists, to different dermatologists. They were not sure to say psoriasis or eczema, but for me it was very clear. It's with that white scabs, it was a psoriasis. And you have it here on the legs also, on the foot. And he's suffering from it. So the case history. He's a teacher of 34 years old. And he has that kind of skin eruptions since 1.5 years. It's a long time now. In former times, he never had skin problems before. Only a bit of dryness around the eyes. But interesting enough, his father also had psoriasis-like skin eruption when he had stress. And his mother has a disbalance of the thyroid, that means autoimmune disease. So he was talking and he said there's a psychological stress at school. He has 2 difficult classes. And the contact with the colleagues is not so good. He would like to have an open exchange, and he feels himself very reserved. He does not like it, but because of the situation at school, and the problem is a bit, he's German. And I live at the border of Switzerland. So we have Germany and Switzerland. And well, we can speak the same language, but the mentality is a bit different. I would say the German people are more open and the Swiss are a bit more reserved. So he was at school, his first school. He had 2 difficult classes as a young teacher. He wanted to exchange his ideas of what he could do better with the children. And the colleagues did not like to talk to him. Okay. And he has a relationship with a younger girl who's living in Great Britain at the moment, and he has to travel. They meet every 3 weeks, and perhaps that was also a problem. So he says, normally I'm a very open person and I like to travel a lot, but at the moment I don't feel well, and with that skin problems, I'm feeling worse. What else? He has bladder, nothing great, but he has to urinate quite often. And normally he never had that. At night he has to go out to urinate. The sleep is not so good. Now in the last 2 years, he's waking up at night. He feels his heart, the tension in the heart region. So we don't have more symptoms. We have that skin problem, which is a chronic skin problems of 1.5 years. And it's a kind of obstinate skin eruption. It does not go and come and go like an eczema. It's just there and it doesn't go away. So, and he has that emotional stress. So I was not sure what to do. I was not so sure. So I started with natrium muriaticum. So here we see the elbows, which are very strong. Sleep not so good, bladder reacting, heart a bit reacting. So I started with natrium muriaticum, a single dose, 200. Normally with skin eruption, I treat with LM potencies, with eczema. But in that chronic case, with that very obstinate, long-lasting eruption, I gave high potency with a special effect, I have to say. So 1 week later, he's telling me the skin is reacting more. It's worse now, the skin, after 1 week. But in a certain way, he's feeling not so bad, perhaps a bit better, psychologically. So, as we know from Dr. Hahnemann, if the symptoms are a bit worse and the patient is feeling better, it could be the right track. But look, the skin is getting worse. So I said, okay, let's wait. Let's wait. Anyway, we have to wait 4 weeks after 200. So let's wait. 5 days later, very active, the skin, but less itching. Oof, I said to myself, perhaps it will be the right track. Let's see. Look here. And you see also some outside, more little pimples, more satellites. I was not so sure about my remedy, honestly, but less itching, okay. Now, after 24 days, after taking the remedy, now the skin is getting better. 3 weeks after taking the 200 and having aggravation in the beginning, we have to say. So now we see it's getting better. It's getting more white inside. 6 weeks later, still nothing, no new remedy, still under natrium. Now it's getting much better. Much better. 4 weeks later, nearly everything is gone. You see still some white discoloration on the skin, but that is normal. He has to go to the next summer with some sun, and that will get colored again. So much better. And he's very happy. But as I'm talking about long-term cases, it was a coincidence. Again, he turned up 2 weeks ago. Oh, sorry. No. Okay. So still on that case, everything was good. So 3 months later, he had been traveling in Spain, in Greece. And now the skin is starting again because it's winter time. At school, he was feeling better. With the colleagues, the problem was gone. He could open more, that was fine. And but now it's starting again. So I asked myself, okay, he's not so introverted anymore. His sleep was better, no complaints about the bladder, everything was better. And he likes to travel. In summer times, in Spain, in Greece, he was feeling great. Actually, he's a teacher of languages, so it's good that he's traveling. He's teaching French and Spanish. So as symptoms, we just had, he likes to travel, better at the sea, better outside. So I said to myself, okay, now I will give a nosode. And I decided to give tuberculinum, because it was not natrium muriaticum anymore. I gave tuberculinum, LM potency, 10 drops every day. And 3 weeks later, he said it went better for 10 days. And then it got worse again, and he stopped the remedy, and everything was fine. So 6 weeks later, despite of the winter time and the cold weather, the skin is much better. So this happened more or less 10 years ago. In that time, he did not have family. Now he is married, he has 2 children, has a very nice wife, which also has problems with the skin. So, okay. So 2 weeks ago, he came again. You see a different age now, 10 years older. And in the meantime, his daughter also has an eczema. And I'm treating the eczema of the daughter. So we meet normally every 3 months. I see the family. So, and now he's developing an eczema, not a psoriasis. Now he's developing an eczema at the arm. So what shall we do? And I asked him, do you have any, everything was fine. Yes, with the school, everything is good. And he said, I said, do you have any emotional stress? And he said, yes. We have 2 children, and we would have liked to have 1 more child. And my wife was pregnant, and she had an abortion. And that was a stress for me. So I decided to give, again, natrium muriaticum. Makes sense. Because it helped before with the skin problems. and now with a miscarriage. We will see. It was last week. He will phone me. I think I'm quite optimistic that will help. And here, look, we are all, not only have long-term cases, we also have the families. So that child, I'm treating her for eczema also. She's a very clever child. And she's getting lycopodium. And you know, there's something very special in lycopodium children in my office. If they normally lycopodium children are very clever, what they don't want. They are a bit they're very, let's say, they're a bit bossy perhaps. But there's one thing I observed. Normally, a lycopodium child, if I ask, can I see your skin? Because I have so many children with skin problems. Normally, they are very open to show, yes, here it is. Yes, here. Doctor, you can look. And that makes it more easy. So she's going well on lycopodium. And from time to time, she needs, in winter, you know, in Germany, in winter time, it's quite cold. We have a aggravation in winter. So our patients with eczema, they are getting worse in winter time. We have nice heating in our houses, central heating, but that air is very dry and people getting more problems. So she's receiving lycopodium. And this is a wife, also the whole family with skin problems. And I know her since many, many years. And she is getting, no, she's much better. She also had an eruption after the miscarriage. And she was helped very much with sepia and natrium muriaticum, the wife. And here you see the daughter and the little boy. The boy is the only one in the whole family who does not have any skin problems. And yes, family is happy. But you know, when they are like this, I'm also happy. And 2 months later, next eruption, something's happening. So the long-term treatment with our patients, we need to have good nerves, a clear mind, and also a bit of luck, I would say. Okay, I have more cases, but that could keep for the next time.
Thank you, Doctor. And those who have question, you can raise your hand and ask question to Dr. Beatrix.
I see some friends from South America. Hello, Ruth. Hello, Sergio. Nice to see you. We have a little group from South America. I think I showed you the case also, yeah, but it's the second time for you. Yes.
Ruth and Sergio. Okay. Okay, Dr. Manoj.
Yes, thank you, Dr. Adini. And somebody should start. That's why I just started the proceedings. There is always some starting trouble, especially those who are.
While you're talking about the starting trouble,
Yes.
when I want to say a few words, afterwards you can start. Otherwise,
yes, good.
You all are aware about our physical meeting on 19th of February. And once again, I am telling we are receiving contributions. Like as Manoj doctor said, everyone is someone have to start. So everyone is thinking one more week is there. So we will send the contribution later. We only not only for the meeting, we have for conducting daily Zoom meeting itself. It's an expense. And for other expenses, we need money, literally. So we are expecting your contributions, and we are receiving contribution from many doctors. Thank you so much for that. And for the international participants, we are giving another bank account for sending your money. Please send your contribution as early as possible. Thank you. And Dr. Manoj can ask us.
Your cooperation through contributions. That's enough.
Sharing is caring, anything.
Yes. Okay. Well, regarding this management, I think should bother about the general management also. What about the diet and regimen, all these things? Then, as Saniman said, the 3 mistakes of physicians. One is the not allowing the medicine to act completely. That is what Stuart Claus often said. It needs wisdom, patience, and courage on the part of the physician. It's always patience. It's most important. At the same time, I think some modifications with diet and regimen might have improved the conditions. What is your opinion, Dr. Beatrix?
Yes, that's a very good comment. Skin eruption and diet, they go very close. And but this is a family who's eating natural food, who are caring about the good alimentation. So here I don't see a real problem on that part. But I have many patients which have problems at the same time as the digestion or with the stools, and here we have to take care. But in that family, I think it's more the emotional stress in the 3 of them. That's why with him, Natrium muriaticum was helping with tuberculinum, and with her, Natrium muriaticum sepia were helping, and she had a free interval of 6 or 8 years. No skin eruption, nothing. Now the miscarriage again, she needed Natrium muriaticum again. Yes.
Yes, moreover, I think with homeopathic medicines, from day 1 to the last day, we can help the persons, not patients, but persons. The first day itself to the last day of his life, without creating much problems to the patient, a soft healing. That is the most important thing. If the common man, or the common citizens or common man, they needs the solace in this way, they can accept homeopathy. If they want to suffer, they can opt other things. That's most important. Thank you.
Thank you, Dr. Manoj. And Dr. Annie is asking for the bank account. Can you please text the bank account for the international participants, please? And Dr. Hariharan, you can ask question. Dr. Manoj or someone else, please share the bank account for the international participants.
Hello, Dr. Beatrice. Your explanation regarding the long-term treatment of the patient is very correct. See, my opinion from my experience is that what you said is correct. See, in advance, I like to say, we homeopaths do not cure completely of a person, because our medicine is acting in reversible direction. See, if you treat psoriasis or otherwise you treat an epilepsy, sometimes it will be cured. Then another symptom will come up. You take the case and that symptom also you can annihilate. Again, next symptom will come. Likewise, a homeopathic doctor should treat a person, see, that person's complete lifetime. He's a person. And then
Yes, Dr. Harani, that's why I was showing that kind of cases, because if we present a case, oh, we have the skin eruptions or we have that epilepsy, and the patient is much better, now finish the case. But our professional life is not like this, because the patient is on his way through life and can develop symptoms here or symptoms there. But on the whole, these 2 patients I was presenting, they are not very sick people. No, but through life, they can develop the body has a certain susceptibility to have something. And if they are well for 4, 5, 6 years and something again is happening. So that's also interesting to teach and to learn from our groups how we go on with that kind of problems.
Okay, that is correct. There is no absolute cure. One after another, it will come out. See, there is no completeness. There is no completeness. One after another, the symptoms will come out.
Oh, there can be a complete cure of one part of disease, but after 5 or 10 years, something can happen in life. Life is biological, and health and disease is also biological. So it's interesting to see a patient for 5 years, but if you see him for 25 years, that makes a difference. So you're right. Thank you very much.
Okay, doctor, your class is very nice, and because your observation is very correct. For that I am appreciating your observation. One after another, it is coming that you are treating likewise after 25 years. See, this is very correct. Homeopathy, it is like we can't. There is no completeness. There is absolute. There is not absolute. Absolute cure is we can't met absolute cure.
Yes, and what was very important for me to share with you that there are also families of remedies like this causticum and the kaliums. We have a connection. It's not from far away because it's the same patient. So if we think in that dimension, treatment can be more easy. Thank you.
Thank you, Dr. Hariharan. Now, Dr. Danish.
Good evening, all, and good evening, Dr. Beatrix Gessner. It's really a very good session. You have shown beautifully how homeopathy works in these conditions, in chronic diseases. And there is no need of fear while treating a patient. Sometimes all symptoms will get out like that. But when you get the cause of the disease, definitely you will be able to finish the case without much failure. And when you finish the case with some beautiful way, sometimes the only very fraction of some problems may come out, but it will definitely vanish without any further medication. That is what homeopathy is all about. When you particularly, for example, you have treated the patient with natramur, that's a chronic that medicine works beautifully in chronic diseases, because that is one of the best remedy for ailments after fright, this depression and everything like that. So definitely that may be the cause of the illness, and that may be the reason why you are able to choose the remedy. And our philosophy also gives such things in our course. But there is no need of worry about that. Sometimes it may was like that. But of course, in acute diseases, there can be every chance of either it may go backward, or sometimes it may get easily cured, but both are different. But in acute diseases, sometimes it may cure without medication, and sometimes it may have a speedy cure. But in chronic disease, things are entirely different. But in chronic disease also, sometimes we get cure, just like in acute disease, very fast cure, unbelievable cures. So that happens with most of the doctors. And since time is running out, I'm not going to elaborate. But anyway, it's a very nice presentation, particularly you being a dermatologist. You have very good knowledge about the diseases itself, and particularly
just a second. And like with that lady, I'm a general doctor. I have a lot of skin patients, but with that lady, look, she gets into menopause. We give homeopathic remedies. She does not have to take hormones. She does not have to take antidepressiva. She gets joint problems. She does not have to go to the orthopedist to get intervention. She has stomach pain. She does not get investigation for the stomach. So that's what to show. we are with our patients and we try that they don't have to get chemical drugs or too many investigations and going on with the waves of life. And that's, I like that very much in my practice.
Yes, this is what really happens when we treat a patient. The patient get a relief, and then she will have a beautiful life for the future. That is what happens with homeopathy. No other system can do such things, because when a patient has recovered from, for example, I just have a case of a hypertension where the patient was very frightful and she was having anticipation for everything. She had a BP of 220 by 110. Every time when people used to take, and she was taking allopathy medicine. But thereafter, I took the case in detail, and she was afraid of driving to vehicles. And very recently, after taking homeopathic medicine, she had a weight of some about 83, and very recently she have just 74 kilos. That means a reduction of weight, as well as she become a normal person. She very last time she came in a scooter, and she told me that, doctor, I drove through the national highway, which is full of buses and vehicles. And that's what happens with homeopathy. She is now really have the courage to drive in public and in heavy roads also. This is what happens with the homeopathy when you treat a case, whether it be cardiology or dermatology, whatever maybe the these or meteorological cases, you will get the result in such a way. Not only the disease organ get cured, but the patient itself is changed back to a normal person. This is what the
Yes.
beauty of it.
And Dr.
Thank
Danish,
you.
and also here you see the patients, they have confidence. They come again. If there are any problems, they come. If there's next problem, 10 years later, they come. So you see the confidence they have in the homeopathic treatment, and that's also very nice.
Okay. Thank you, madam.
Yes, thank you.
Thank you, Dr. Danish. And I'm inviting Ruth for giving out of thanks. Ruth Deichmann. Please.
Hello, nice to meet you. I don't talk a lot of English, I'm sorry, but I'm from Argentina, from the Pasquero School, and I met Beatrix the last night, and now I want to hi for everyone and thank you.
Thank you so much for talking few words with us. Thank you. Thank you very much. And now it is the time to end the session. To our and we will start our local language Malayalam session. And thank you so much for Dr. Beatrix for giving such a nice presentation. It was so cool and calm. You are giving the presentation like talking with us. Really, it was a great experience for me. And
thank you very much. And did you see the joke, Dr. Danish and me were making a joke with the announcement? You saw the picture with the snow?
Yes, that's a beauty. Full
Yes.
of really an amazing picture was sent by Dr. Beatrix Gessner, and that picture was used for this poster today.
It was yesterday. I was in the snow,
Yes,
and I said, "Put me a nice picture for the presentation."
Definitely,
So,
definitely.
yes.
We like to have such wonderful persons in our forum and to have sessions.
Thank you, Dr. Danish.
thank
So
you.
I also say thank you very much to everybody and to IFPH, and it's always a pleasure to be with you and meeting next time again. So
Thank you, everyone. And now
Thank you. Thank you.
inviting Dr. Danish for Malayalam session, to moderate Malayalam session.
Thank you, Dr. Ajini and Dr. Beatrix Gessner.